ఏ ఊరంటే అందరూ తెలిసినట్టు ఎక్స్ప్రెషన్స్ ఇస్తారు తెలుసుగా నేను ఎప్పుడైనా చూసా వచ్చి చాలా చాలా గ్యాప్ ఇచ్చాను అందరు ఇచ్చారు ఇదే కదా అందరు ఇచ్చారు
ఇక్కడ కాదు మా కట్ అయిపోయింది ఈ మధ్యలో ఛార్జింగ్ కూడా ఎక్కడ ల్యాప్టాప్ కాస్ట్లీ ఫోన్ మా నుంచి చెప్తుంది కాస్ట్లీ ఫోన్ దినేష్ గారు ల్యాప్టాప్ అంటారు
ఒకసారి తప్పుకొని సైడ్
Good evening, one and all. A very warm welcome to all the dignitaries, professors, beloved parents, graduates and non-teaching staff to the 10th graduation ceremony of GSL institutions of 2012 batch.
It gives us immense pleasure to invite you all to the Convocation ceremony. It is always a day of joy and is the most awaited event in every student's life that marks the completion of an educational journey and commencement of another more uncertain and difficult part of students' quest for a better life in future.
Truly today sums up the years of hard work that they have done for their relentless pursuit of knowledge that will enable them to grow as a person and take up new challenges with clear vision.
This evening, we have among us in the gathering who have taken time out of their valuable schedule to join us and be a part of this memorable event.
Now we request our chairperson, Dr. Ganibhaskar Rao Garu, a renowned laparoscopic surgeon, our chief mentor and the member of Medical Council of India to come and proceed over the function.
Now, we request Dr. Gani Sandeep Garu, the youngest director of GSL Healthcare Institutions, alumni of GSL Medical College of 2005 batch, presently pursuing PhD in Medical Simulation Technology. our beloved Superintendent, Brigadier Dr. EVSP Murthy, an eminent anesthesiologist and an organ transplant specialist who is also a member of Indian Society of Anesthesiology, to come and occupy the seat on the dais.
Now we request our principal, Dr. Y.V. Sharma Garu, an impeccable administrator, an excellent teacher who is reputed in the scientific community, to come and occupy your seat on the dais.
Guest of honor, Dr. Udo Srinivasagaru of AP Medical Council, the gold medalist in MD and DLO, who is a member of Indian Chest Society, American Thoracic Society, the Indian Association of Bronchology, to come and occupy the seat on the dais.
Now the chief guest of the evening, Dr. C. Palanivellu Garu, Chairman of GM Hospital and Research Center, Professor and Director of Institute of Gastroenterology and Access Surgery, and Managing Trustee of GM Digestive Foundation Charitable Trust. Dr. C. Palanivellu Garu was the first Indian to win International Silver Olympic Medal for surgery held in Phoenix, USA. He has already received gold medal in honorary contribution for surgery. We kindly request you, sir, to come and occupy your seat on the dais.
లేదురా ఇప్పుడు ఉంది దాంట్లో ఏదైనా పెట్టారా ఏదైనా ఫిక్స్ అయ్యాను
Now we invite A. Sumastri. We request all the audience and dignitaries to stand up for the prayer.
Go back.
podium sound.
Thank you so much, Sri.
May the darkness of ignorance be driven away by the light of knowledge. Now we request the dignitaries to kindly light the lamp.
Taking a slight detour from the regular events of Convocation, as young students of Future Kids School have to go back after giving a wonderful ceremonial performance, we request the students of Future Kids School to come onto the dais for a picture. Now, we request our chairperson, Dr. Ganibhaskar Rao Garu, and Principal Y.V. Sharma Garu to award the Future Kids High School students with a certificate of appreciation. M. Srinivas, P. Nagapranay, P. Nagapranay, M. Nikhil Newton, K. Rahul, S. Jenish, V. Saugand, M. Rishishwara Suryateja, B. Yashwantraj, D. Bhavit.
N. Sri Kavya, G. Manasi, G. Neha, V. Hasani, S. Likita Vaishnavi, M. Nikita Florence, M. Satvika, D. Ashwin.
We request the bandmaster Nageshwar Rao Garu to come onto the dais and take a memento. Ladies and gentlemen, please give them a warm round of applause.
Now we welcome Dr. Ganibhaskar Rao Garu, the chairperson of GSL Educational Institution, to give the presidential address.
Respected dignitaries in the dais, especially Dr. C. Palunvelu, who is all the way came from Coimbatore, just one phone call and make you address and make the award for the degree for you. For the, all the, is a busy surgeon. I know last 25 years and he practiced in Coimbatore and you know not only India, all over the world is the best surgeon in the country and most of the world part. And it is the greatest occasion for all the students make a graduation, is a first graduation after post graduation. So remaining things a different part, but graduation in your lifetime is the first part, important occasion. You want to make it a little bit memorable one. That's why the eminent people in the country, they'll come over here, they'll tell their own story, how they're developed. At least 5 to 10% people have changed the mindset and what the development of you and development of your place, development of your country and developing the world for the best technique and technologies and medical facilities and medical care, other things. Like that one of the biggest example, Dr. C. Palunvelu. I wish all the students best of luck in future. Think about only the profession, don't think anything, don't think about politics, don't think other things. Think profession, you're going to be greatest successful man in the world. Thank you all.
Thank you, sir. Now we request our beloved principal, Dr. Y.V. Sharma Garu, to present the academic report and address the gathering.
Honorable Chief Guest of this evening, Dr. Palunvelu, our beloved Chairman, Dr. Gani Bhaskar Rao, Director, GSL Educational Institutions, Dr. Sandeep, my colleagues from the faculty, dignitaries of the dais, proud parents of the students who have graduated this year, invited guests, press bureau, and my dear students. On the occasion of graduation ceremony of the 2012 batch MBBS students of GSL Medical College, I take immense pleasure in welcoming our chief guest, Dr. Palunvelu, guest of honor, Dr. Srinivas, and our chairman, Dr. Gani Bhaskar Rao. Thank you, sirs, for being with us on this evening, despite your busy schedules and commitments, to bless our students on this auspicious occasion. It is with pride and pleasure I present the academic and co-curricular achievements of this batch of 2012 batch. This is the 10th batch of medical students passing out from this prestigious institution as full-fledged doctors to take up the challenges of healthcare in this country. 150 aspiring young girls and boys were admitted to GSL Medical College in the academic year 2012-13. Today, those boys and girls are walking into the portals of medical profession as responsible young doctors to serve the nation. They have done exceptionally well academically and otherwise and brought laurels to the institution. In the first MBBS university examination held in August 2013, 130 students appeared for the examination and 108 of them were declared successful, giving an 80%. 12 of them scored overall distinctions, 54 passed in the first class and the remaining in the second class. Kumari Perumalla Sri Lakshmi obtained distinction in anatomy and biochemistry and secured overall first position. Kumari Potumudi Shaini with the distinction in biochemistry and physiology stood overall second in the batch. Kumari Tota Geetika Pratima with distinction in anatomy shared the second position with Pratima. 17 students in biochemistry, 19 in anatomy, and 7 students in physiology secured distinctions. 131 of this batch of students appeared in second MBBS university examination held in February 2015. Of these, 114 were declared successful, giving 87% pass. 5 students secured overall distinctions. 7 students passed in the first class and 39 in second class. Kumari Tota Geetika Pratima with distinctions in pathology, pharmacology and microbiology secured overall first position. Kumari Koppirala Nikhila with distinctions in forensic medicine stood in the second position. 15 students in pharmacology, 9 in microbiology, 5 in FTM and 12 in pathology secured distinctions. In the part 1 of the third MBBS university examinations held in February 2016, 106 students out of the 131 appeared were declared successful, giving 81% pass rate. 11 students in ENT, 6 students in ophthalmology obtained distinctions. Kumari Tota Geetika Pratima scored 313 out of possible 400 marks and secured first position in the batch. Kumari Chilukuri Shushmita stood in the second position. In the final MBBS university examination held in February 2017, 118 out of 127, that is 93% of the students were declared qualified. 32 of them passed in the first class and 85 in second class. Kumari Tota Geetika Pratima secured distinction in general surgery, distinction in pediatrics and overall distinction in the batch and stood first in the final MBBS examination. Kumari Chirukuri Shushmita with the distinction in general surgery secured second position. Shri P. Bobby Prashant secured distinction and stood first in general medicine. Students of this batch participated in Illuminati 2014 at AFMC Pune, Amara Reignite 2015 and Pedicon 2016 in Tirupati, presented scientific papers and won medals. These young men and women have not only done well in academics but also excelled in co-curricular and extracurricular activities. Mr. K. Akhil and Ms. Triveni represented NTR University of Health Sciences in South Zone Intercollegiate Shuttle Badminton Tournament and volleyball tournaments. Mr. K. Akhil also secured third place in long jump in intercollegiate tournaments. Mr. Praneeth secured second place in shot put and third place in discus throw in intercollegiate athletic meets. Students of this batch have demonstrated exceptionally high quality of organizational skills, pooled their resources, and supported several professional CMEs and conferences held in GSL Medical College. The management of the institution continuously is striving hard to improve the quality of academics and quality of life of students in the campus. In our new draft strategic plan of the college, there is renewed emphasis on academic excellence among the students and the staff. To facilitate our students to become competitive and score ranks in the NEET PG examination, the management has launched G-NEET academic program from this year onwards. Our young doctors who have graduated today will be the first beneficiaries of this program. We envisage to integrate this program into our regular curriculum of the graduate medical education from 2019 onwards. It will not be out of place to mention that our 2006 batch medical students, first year students, achieved 100% results in first MBBS examination held in 2017, and they have scored maximum number of distinctions in the university examination in 2017. In the final MBBS results announced a couple of days ago by the university, our 2013 batch students also secured 89% success rate. We hope the trend will continue and even higher levels of achievements will be made by the students of our institution. The management on its part left no stone unturned to provide best facilities, whether infrastructure, equipment, manpower, and online library to get the best out of our students. In line with the vision and goals of the institutions to provide urban healthcare facilities at the doorsteps of the rural masses, we have added several state-of-art medical equipment to GSL General Hospital Armamentarium. Our medical superintendent will be briefing on the subject. GSL management had added a world-class surgical and medical training platform in the form of GSL Smart Lab, aimed at remodeling the approach towards patient safety and clinical training. It has a cutting-edge training system with new-age fidelity simulators, a modern skill lab, basic and advanced skill training mannequins, and dedicated team of faculty. The college has signed linkage agreements for scholarly exchange between West Virginia University and GSL institutions. It also signed several MOUs between GSL Smart Lab, IAES, and the European Association of Endoscopic Surgeons, and many other institutions. 18 of our undergraduate medical students conducted ICMR research projects in the current academic year. Some of these students presented their research papers in national conferences. In consonance with the thinking and direction of the government of Andhra Pradesh, the management of GSL educational institutions installed solar power generator plant on the roof of the medical college and in the campus of its rural health center. Our solar power generation is generating 2.5 megawatts solar power as against its daily consumption of about 12,000 units. We are proud to say that GSL healthcare institutions are the first in the country to run completely on green power. MCI has approved commencement of postgraduate courses in 20 broad disciplines from the academic year 2011-12. All postgraduate courses conducted by this institution are recognized. In the postgraduate examinations held in May-June 2017, 50 out of the 58 students who appeared for the degree examinations were declared successful, and in diploma, 9 out of 10 were declared successful. Dr. Ramya Metla ranked first in the university in MS Ophthalmology, and Dr. V. Navajyoti topped in MD Anesthesiology in Dr. NTR University of Health Sciences during the current academic year. I call upon all our passing out students to strive hard to get PG seats in this college and enjoy best academic and campus facilities. On behalf of the management and staff of this college, I wish to thank each one of you for bringing credit to the institution. I also congratulate the parents and families that have given you such a strong foundation to excel. You all can be proud of your achievements. Lastly, but not the least, I like to place on record our sincere thanks and appreciation to the students of Future Kids School who provided band support to the march past. We wish to see them as students of this college in the years to come. Thank you. Godspeed.
Thank you, sir. A small announcement. This program is being streamed live on Facebook and YouTube page GSL Institutions. Please do watch and like the program. You can also download your photographs from the Facebook page GSL Institutions. Now we request Dr. G. Srinivasul Garu to sensitize the graduates on medical ethics.
respected dignitaries on the dais, respected teachers, senior colleagues, and my dear young friends. Very, very good evening. Little birds are ready to spread their wings and soar the sky to make their mark in this world. My congratulations to these little birds, and I wish them all good luck. It is indeed a pleasure to address such an enlightened and energetic gathering as a member and representative of AP Medical Council. My role is create awareness about the medical ethics. Ethics are not personal feelings, not religious rules, not a law, not a culture, not a science. Ethics are moral principles. They tell what is good and what is bad, what is right and what is wrong. They are based on value system. They are not universal. Always follow ethics. They protect you always in many ways. I wish to highlight some of the points. Whenever if you want to treat the patient, first create confidence in the patient. The reputation is more important. If there is no faith in the treating doctor, no drug works. Nowadays, people are not trusting the doctors because of high cost of modern medicine, and pure communication between the patient and the doctor. Try to give cost-effective treatment always. Try to minimize the investigations by using your good clinical sense. Of late, there are increasing attacks on the hospitals. What is the reason? Exuberant charges on the part of the corporate setups and costly deaths. Previously, deaths are not so costly. Nowadays, people are spending lakhs and lakhs of rupees. They want good result, but it is not always possible. That's why these attacks are happening. To prevent this, we have to minimize the cost of the treatment, and we have to explain the outcome of the patient, and we have to explain each and everything to the patient and attendants. Good communication skills plays a vital role in the management of any disease. You have to tell frankly about the problem. Don't exaggerate or undermine the problem. Never give guarantee. Never stress about the admission and treatment in your hospital only. Never insist for admission and treatment in your hospital only. Please give some options. If they are poor, ask them to go to the government hospital or teaching institutes. Patient education plays an important role in the management of any diseases. You have to explain the disease proper, disease course, complications, and the complications of defaulting. You have to explain about the disease to the patient. That plays a vital role in the management of any disease. Always give a legible prescription, but best one is either typed or computerized. Keep and maintain very good medical records. Prescribe good quality medicines always. Please check the quality and bioavailability of the drugs. Don't get tempted to offer gifts and trips. Respect always your senior professional colleagues. Never talk bad about your colleagues. Anybody can commit mistakes. There are so many role models in and around you. I know your chairman, sir, Dr. Ganni Basra Garu, for more than 20 years. He is very dynamic, energetic, and hardworking. He works more than 18 hours per day. He did keyhole surgeries and thoracoscopy 20 years back. He is the first person who brought the most modern medical technologies to the coastal Andhra Pradesh. Always try to learn the knowledge and the clinical skills from these great personalities. Medicine is an ever-changing science. Update yourself from time to time. Otherwise, you will be like a old newspaper. Nobody is interested in seeing and reading the old newspaper. Likewise, nobody wants to consult if you don't update yourself. Don't be crazy after money. Sincerity and hard work always pays you. They bring name, fame and wealth. Never cheat the patient. Never cheat the patient. It is better to beg rather than cheating the patient. You should always keep one thing in your mind. Nobody is safe until all are safe. Disease and poverty anywhere is a threat to elsewhere. Our motto should be Sarve Jana Sukhuno Bhavantu and Sarve Jana Sujino Bhavantu. Jai Hind.
Thank you, sir. We request Brigadier TVSP Murthy, Medical Superintendent of GSL Educational Institutions, to administer Hippocratic Oath and address the gathering.
Good evening, GSL. A very important day to remember, especially for those students who are passing out today and putting their step into the next part of the phase of their life. It will be a very thrilling day for them and equally thrilling for the proud parents who are here. Honorable esteemed guests, Dr. Pallanvelu, the other dignitaries of the institution, students, parents, and other staff of the GSL institutions. I'm here as Medical Superintendent of the hospital to tell you what is the Hippocratic Oath. It's in a nutshell about what Dr. Srinivas has just told about the ethics, how you should behave and how we all should behave, especially when we are in a patient-doctor relation. Before I really take you all to the Hippocratic Oath, I want to congratulate today's huge batch of 135 students. Good evening, Spartans. Good evening, Titans. And good evening, Janizers. It's a mixture, it's a mixed bag of all the three, and they are the proud people who are walking away today. Most proud moment in their life. Before I try and teach some sermons to you, I would like to say something about the hospital. I look after the hospital, and you people have been there in the hospital for the last 1 year. I'm sure that it has been a very educative experience to one and all. And for the parents and for those people who are not aware of the institutional rise in the ladder, I would like to highlight that we are happy to share with you all certain important facts which prove to be a great milestone in the history and in the path of the GSL's expansion. In the last 1 year, the following changes have taken place. We have added super specialty to the existing medical care in the form of urology, gastroenterology, nephrology. And also we entered into a memorandum of understanding with the NTR Vaidya Seva in these specialties, and it is bringing in a lot of deserving patients, and they are having their treatment over here. We restarted the Smile Train program through the NTR Vaidya Seva, and it has been given a lot of succor and relief to all the affected children with cleft lips and cleft palate. In the recent few months, we started a novel program with the brainwave of the Honorable Chairman, which is called as a Uyala scheme, where all the needy and the deserving antenatal pregnant ladies and mothers and would-be mothers are given care free of cost right from the antenatal visits to the point of delivery, everything being borne by the GSL institution. This is a novel service which is being done in this institution alone and nowhere else in any private institution till date. This deserves a big applause from one and all for the wonderful hand which the GSL institutions are doing, and this particular seva is being not only done for the the people in and around the district, but also we are happy to say that seeing the response and seeing the expertise with which the service is being given to the needy, the collector of the district has requested, and we have entered into a memorandum of understanding, that all the seriously ill cases, the high-risk pregnancy cases from the government general hospital of Rajahmundry are coming to our hospital, which is a big step in its own, and we are taking care of these people in the same scheme of Uyala and extending our benefits to the needy. We entered recently into a memorandum of understanding with, again, a government organization in trying to uplift the medical services of the urban health centers in and around the hospital, and we are the nodal center which has been picked up by the state government machinery, and we will be giving consultations to all the needy people through online in the form of a telemedicine, and it will be starting probably in a week's time, and that's a big step in the history of the medical services being rendered by the GSL institutions. In the recent past, depending on the need and with a view to expand and to give more comprehensive health care to one and all, we have improved on our inventory as far as the equipments are concerned, especially in the field of critical care, and the hospital is bestowed with kind courtesy, Honorable Chairman, with all the latest critical care equipment, including dialysis, ventilators, monitors, so on and so forth. I'm happy to share with you that the GSL Institute is first of its kind in the southern part of this country to get a digitalized version of our radiology services in the form of MRI, CT, and mammography. In the recent past, this hospital came into limelight by extending free breast cancer surveys, treatments, and identification of all those people who are a potential candidate for a breast cancer, and it gave us a thumping response throughout the state. We never stopped at this place. We would like to take medicine to the doorstep, and we are starting very shortly the mobile hospital services, in which we'll be starting 2 highly equipped state-of-the-art mobile ambulances, which will be equipped with the OP facilities for eye, ENT, surgery, radiology, and radiotherapy to one and all, and it includes all the investigations which you can think of at the doorstep of the individuals, which will be a big boon to all the needy in and around the district. The lineal accelerator at the cancer hospital has been replaced with one of its kind in the country, and GSL stands first to have such a thing, to see and take care of those people who are suffering from cancer. We also started a memorandum of understanding, and we have entered into an agreement for the benefit of all the needy people in the form of getting into an agreement of the employee health scheme and the Arogya Bhadra, especially for the service people in the form of all the police people, and we are ready to take care of them. The smart lab, which the principal sir has already mentioned, has seen upgradation in the various equipments and the simulators which are over there in the form of new upgradation services, especially for various highly skilled mentors in the smart lab. We created a special lounge in the hospital premises itself for all the attendants of the patients who are staying back to look after their needy and the loved ones at a very minimal cost, and they are being accommodated and given all the basic facilities for which they can be very, very happily staying over there and looking after the needy ones. For all the doctors who are working round the clock to make all the patients happy, the doctors have been given a big uplift as far as their canteen services are concerned, and most of the protocols and procedures have been streamlined in the last 1 year. One would be happy and one would be lucky enough to serve in an institution like this, and you all have been those in the last 1 year. You had an exposure to various departments, you had an exposure to put your hands on various equipments which I have just told, and you have had an experience and an exposure in the various critical areas, especially in various ICUs, the casualty, accident and emergencies, and specifically in the operation theaters, which are the state of art. I'm sure that this 1 year of toil which you underwent, and added to that the 1 year of academics which you people had been participating, will bring you a lot of emphasis, especially on your foundations, and will help you seeing through the further part of your career. I wish that you all do well and excel in the forthcoming competitive exams and take the path of your choice in either the field of medicine or surgery, and also excel later on to the subspecialties of your choice and bring a wonderful name to yourself, the institution, and to your parents especially. I would like to take your time in trying to make you undergo and pledge the Hippocratic Oath. Before that, I would like to mention one sentence that you all have passed out. You are now stepping out into the world as independent doctors. More than practice of medicine, I want that you all should be humane at heart, treat patients with love and affection, talk to them nicely, and use your soft skills in such a way that there is no trouble for you in your career. Most of the troubles which you keep listening, seeing on TVs, and reading in the press media are because of we fail to execute our soft skills at the correct time in a correct way, which puts us into a lot of embarrassment which could have been avoided most of the time. I want all of you to remember this, and these are the golden gospel truth which will take you to places if you practice them most religiously and honestly. As already been told, honesty is the most important thing in this profession, and be brave enough to admit that if there is a fault from your side, and so that we are humans and we are supposed to make mistakes, but as humans we are also supposed to get them corrected ourselves. So pay attention to these, and I'm sure that you will definitely have a beautiful tomorrow for all of you. I would now request all the wonderful outgoing students to stand up for the pledge and put your right hand up. Put your right hand up as a mark of that you are taking the pledge, and try and understand the words which are being told. I request everybody to repeat whatever I recite. This is the Hippocratic Oath. I swear by the Apollo physician, the Asclepius, by